Of course, in a big city like New York, there is bureaucracy, especially also in the medical field. Was it challenging at some times to get all the regulations together for your unique approach to dental care?
Well, it was nearly impossible. Let's just leave it at that. So originally, MediDental Care was formed back in 2018. You know, we have like our slogan, a healthy life starts with a healthy smile, which again integrates medical with dental. And originally we started off as a dental only. So the state only let us operate as a dental facility until a couple of years after, which we proved to them how we're able to integrate the medicine also within the dental atmosphere. You know, because the dental are surgical chairs as well. And we were able to prove to the state the patient quality and the care, how it could be done, and kind of bring this new idea out to them. You know, like I said, there are a lot of buildings and a lot of offices, whether it might be a hospital or privately owned place, where they do offer medical and dental in the same building. But it's still two different administrative offices. It's still two separate appointments that you have to make. You still don't get the convenience. Over here, it's that we were able to prove to the state how important this is, right? Like you said, a holistic approach, how important this is in order to kind of integrate this in one chair, in order to make it that one visit, to encourage patients to be able to do their yearly checkups versus telling them, hey, listen, you know, we have medical next door. Why don't you book an appointment with them? You know, most people are like, I got to go to work. I got to go pick up my kids. I have no time for this right now, you know? So over here, it's like you're already sitting in the chair and like, oh, hey, you know, you could get your primary care visit done for the year as well. Oh, I don't have to go anywhere? Yeah, you're sitting right over here. And boom, doctor comes in without them moving, doing the blood work, doing any shots that the patient needs, all done in one visit. And typically, just for you to know, if a patient just comes in for a regular dental checkup or the patient came in for just regular medical checkup, the visit could be as, you know, anywhere between an hour to an hour and a half between both, you know, just for regular checkups, you know, not if they need any actual work done, which is amazing because just for a person to go into a dental office, usually it's like a 2.5 hour appointment between getting them in and, you know, getting doing the exam, x-rays and cleaning. And then after that, doing a separate appointment with a medical doctor. That's also another 2-3 hours over there. What I like to say is that in New York, convenience isn't a luxury, it's a necessity.
Yeah.
And that's kind of what we bring out in MediDental Care.
But it does seem as difficult on the bureaucracy side as
Yes.
one could imagine.
Yes.